Some changes in your face are harmless signs of getting older, but others, the ones that people often brush off as just aging, can be early warning signs that something more serious is happening inside the body. I'm Dr. Danny Fisher, a board-certified anesthesiologist, and before a patient ever goes under anesthesia, I'm already looking at their face for clues. Skin color, little skin growths, or rashes, because your face can reveal problems with your heart, circulation, lungs, liver, kidneys, or nervous system before you feel seriously unwell. So, in this video, I'll show you 7 facial changes you should never ignore, what they can mean, when they're urgent, and when it's time to call a doctor. Okay, let's talk about the first one. Small yellowish patches near the inner corners of your eyes. Doctors call this xanthelasma. It looks like a soft, slightly raised, pale yellow bump sitting right by the bridge of your nose. Here's the why behind it. Those yellow patches are actually deposits of cholesterol sitting under the skin. They don't hurt, they don't itch, and a lot of people assume it's just a normal part of aging. But in a meaningful number of cases, this is one of the earliest visible signs of high cholesterol, sometimes even before a blood test would catch it. It doesn't mean something seriously wrong. It means that it's worth getting looked at by your doctor and maybe getting your lipid panel checked. The next thing that I want to address is called spider angiomas. These are those tiny, spidery red or purple marks on the skin, usually a central red dot with a thread-like line that radiates from it, almost like a small firework. A few of these on their own, especially as we get older, can be completely normal. The big thing I want you to understand is that when you see several of them appearing together, especially on the face, chest, or upper body, it can be a sign that the liver isn't processing hormones the way that it should. That's because estrogen, when it builds up, can cause these tiny vessels to dilate. 1 or 2 spider angiomas isn't an emergency, but a cluster of them is definitely worth mentioning to your doctor. Let's talk about the third skin condition that is not necessarily aging, and it's called acanthosis nigricans. This one is a mouthful, but what it actually looks like is pretty simple. It's a darkened, thickened, almost velvety patch of skin. It's usually around the neck, in the armpits, or sometimes on the face. A common situation I see is that patients assume that it's just discoloration or a tan line that won't fade, but this particular change is one of the most reliable visible markers of insulin resistance, meaning that your body is having to work harder than it should to manage your blood sugar. It's often one of the earliest physical signs that shows up before someone is ever diagnosed with prediabetes or type 2 diabetes. Now, it's not a diagnosis on its own, but it's a strong enough signal that it's worth getting blood sugar checked. The fourth thing that I want to address is called a malar rash. This is a rash that crosses the cheeks and the bridge of the nose in a shape that genuinely looks like a butterfly with its wings spread. Here's why this one matters. A malar rash is one of the classic visible signs associated with lupus, an autoimmune condition where the immune system mistakenly attacks the body's own tissue. Now, not every redness across the cheeks is lupus. A skin condition called rosacea or a sunburn can look similar, but if it's persistent and it doesn't fade in the way that a sunburn would, and especially if this rash comes with joint pain or fatigue, that combination is worth bringing to a doctor's attention. Okay, let's talk about the 5th skin condition that is not necessarily aging, and this is called periorbital myxedema. In plain language, this is a particular kind of puffiness around the eyes, and it's not the kind from a bad night's sleep, but a firmer, more persistent swelling that doesn't go away as the day goes on. This specific kind of puffiness is closely tied to hypothyroidism, meaning that the thyroid isn't producing enough thyroid hormone. When thyroid hormone is low, the body can accumulate certain substances under the skin that cause this firm swelling, particularly around the eyes. So if you've noticed this, along with fatigue or weight changes or feeling cold all the time, your thyroid is a reasonable place to start asking questions. The next thing I want to address is called a heliotrope rash. This is a purple or violet discoloration of the eyelids. Heliotrope actually refers to a purple flower, which is exactly the shade we're talking about. Now, this one tends to get missed because people assume it's just shadows or fatigue, but a heliotrope rash is strongly associated with dermatomyositis, a rare autoimmune condition that affects both the skin and the muscles. It's often accompanied by muscle weakness, especially in the shoulders and the hips. It's not common, but it's distinctive enough that when I see it, it definitely gets my attention. And finally, let's talk about the last sign that is not necessarily aging, and this one's a bit more obvious once you know what to look for. It's a yellowish tint to the skin, or even more telling to the whites of the eyes. That yellowing in the eyes specifically has a name. It's called scleral icterus, and it's actually one of the earlier and more reliable clues, often showing up before the skin itself looks yellow at all. This yellow color in the eyes or the skin comes from buildup of bilirubin, a substance that your liver normally clears out as it breaks down old red blood cells. When the liver isn't processing it efficiently, or when something is blocking that pathway, bilirubin can build up in the bloodstream, and it starts to show up in the skin and the eyes. A faint yellow tinge that comes and goes isn't automatically alarming, but a noticeable, persistent yellowing, especially paired with dark urine, pale stools, fatigue, or abdominal discomfort, points toward the liver, gallbladder, or a pancreatic mass, and it's absolutely worth getting checked. Now, no single sign on this list means that something is definitely wrong. The real skill, and this is true whether you're a doctor or whether you're just paying attention to your own body, is noticing when something is new, when it's persistent, and when it shows up along other changes like fatigue or weight shifts or joint pain. So the big thing I want you to remember is this. Your face is not just aging, it's communicating. Most of the time what you're seeing is harmless, but knowing what's normal and what's worth a second look is one of the simplest ways to catch something early while it's still easy to manage. Have you ever noticed one of these changes in yourself or someone you loved and wondered what it meant? Tell me in the comments below. I read every single one. Until the next video, stay calm, stay informed, and I'll see you in the recovery room.